Coronavirus cases are climbing again nationally and here in Indiana.
The CDC reports new cases have quadrupled in the country over the past 6 weeks.
WRTV's Nikki DeMentri has learned that cases here are rising slowly, heading toward positivity numbers we saw at the end of the winter surge. Nikki, what is next for the virus?
Nicole and Mark, one expert I spoke with today says he's hoping that this is just a short blip in rising cases. But, as we saw those projections from the CDC and other agencies, positivity rates and numbers will continue to rise again as they're projecting. Now, Dr. Sean Granis with the Regenstrief Institute here in Indianapolis shares that in late March and early April, the state saw upwards of 120 positive tests a day. Now, he says the state is seeing about 1,000 positive tests daily. Experts say the real number of cases are higher with unreported at-home tests and people not getting tested at all. Now, Granis adds numbers are still relatively low in comparison to the rest of the country, but he adds spikes in the virus usually start in the coast and make their way inward as time goes on.
We need to watch what's happening with these rates and see if there is a continued progression towards us. So I think we need to continue to be vigilant and watch the numbers and understand what's happening.
Now, outside of masking, experts including Shandy Dirth with the Fairbanks Public School of Health adds that vaccines are still the best tool in the fight against COVID. She encourages those eligible for a booster shot to go ahead and get that vaccine. Now, traditionally, viruses die off in the warmer months, in part since more people are outside. I asked Dirth why that's not the case right now.
I think it's a number of factors. One is not everyone was boosted. And so some of those people who may have been vaccinated a while ago at this point, they might be more susceptible to get COVID themselves. And then also, if you think about all of those people who had COVID in December and January, maybe who weren't vaccinated at all, whatever immunity they may have had for a short period of time after having actual COVID, that's starting to really decrease at this point. So they're really vulnerable to get COVID. And I just like to remind everyone, you can get COVID multiple times.
Yeah, good reminder there. Now, the statewide contact tracing program is no longer in place. Dirth tells me it's now up to each county health department. Here in Marion County, the program, which she leads, will continue for another year. Mark, Nicole.
All right, Nikki, good information. And we are just 10 days away now from the Indy 500. What do these experts say? Do they have any concerns about all those crowds out there?
Well, Nicole, there's always a concern when there are thousands and thousands, hundreds of thousands of people getting together. They say really it's going to be up to every single fan and driver and whomever is there to take matters into their own hands. If they feel more comfortable masking, please do that. If you feel comfortable social distancing, try to do that as well.
All right, our Nikki DeMentri live in studio tonight. And just this afternoon, the CDC's Independent Advisory Committee gave approval to boosters for kids ages 5 to 11. The panel voted 11-1 in favor of approval. CDC Director Dr. Rochelle Walensky is expected to give final approval shortly. Boosters could be available as early as tomorrow morning, but keep this in mind. Overall, less than 30% of children ages 5 to 11 have been fully vaccinated. In Indiana, that number is 21%.